Thank you, Governor. Thank you. Good afternoon, everyone. Thank you for joining us at 2:30. I appreciate the Governor's updates, and I also want to echo many things she said, but the first I'll start with is acknowledging tremendous appreciation to the work that's being done at the Department of Health in partnership with our colleagues from the National Guard, both the case investigation team and the contact tracing team. You all know who you are, the countless hours of work. It truly is tremendous. Whenever I hear positive feedback about what we are saying here and doing, I always think of that group of people and our data team and our communications team behind the scenes, who is really the group that's my unsung heroes in helping us move forward through this response. So thank you. Let's get started with the data. We have 272 new cases, all of whom the team is working through, getting results to, and supported by technology and all of the amazing testing that's being done. There are 324 people currently hospitalized. Of those people, 86 are currently in the ICU, and 60 people are on ventilators in the ICU. Again, as I said yesterday, the stability in these numbers is certainly an important sign, and we will continue to follow every single day as we have been doing. Sadly, we have 15 new COVID-19 associated fatalities to report. There was one person in their 50s, 2 people were in their 60s, 4 people were in their 70s. We sadly lost 6 people in their 80s and 2 people in their 90s. Our deepest condolences are with the families of those we have lost. Please know how sorry we are for the passing of your loved one, who is a precious Rhode Islander. That motivates us to continue forward with the important work that the Governor has been sharing. In terms of testing, I want to really thank the Governor for her leadership in this area. It's her vision that's really set us apart as a state and what's going to keep us with going forward, as she shared what we will be aiming for. It's what motivates the entire team of many, many people who are working so hard behind the scenes to make testing a real success story in Rhode Island. It already has been, and we absolutely are aiming for it to continue to be so. As the Governor has said, our average testing numbers per day are well above the target that she set for Rhode Island just a few weeks ago. And they put Rhode Island in the top tier of testing nationally. This is something that we can all be proud of. In particular, we can be proud of the Rhode Island Department of Health's state health laboratories. That includes the leadership team there, including Dr. Eva King and Dr. Richard Heward, and all the incredibly hardworking staff at the lab. If you can imagine, we are testing every single day. That means there are people at that lab and the labs across the state every day so that we can get results and respond to them as a critical part to this. In the early days of our response, the RIDO State Health Laboratories was the only lab testing in the state, and it is still doing a significant amount of testing, far beyond what we ever thought when this first started, while the leadership of the lab is guiding Rhode Island's overall testing strategy as well. So why does testing matter? Why is testing so important? As I said 2 days ago, it's a critical piece. It's one tool in our entire toolbox, so it's not the only one, but it's important and a critical one. During any infectious disease outbreak, testing helps us identify cases and get people isolated and treated quickly and effectively. This helps people who are sick, and it's critical to helping prevent further spread. That's always the bottom line of what we're aiming for. You hear me say it when we talk about social distancing and wearing a mask. Testing and getting people identified who have COVID-19 is critical to being able to then isolate and quarantine people and prevent further spread. Testing is particularly important for COVID-19 because of the nature of this virus that we're learning more and more about every day. We know that COVID-19 spreads easily between people in close contact, among groups, and that there are several different symptoms that can occur causing COVID-19. Both of those factors make it harder to identify cases without a test. With certain viruses, there are definitive, clear, telltale symptoms that help us know, yep, that's that particular virus. With COVID-19, people have been presenting with a very wide range of symptoms, from fever to just a little bit of sore throat to just a headache. Sometimes they only have one symptom. So testing for COVID-19 allows us to identify individual cases and clusters of cases so that we can get people into isolation and quarantine right away. Testing is also critical because it helps public health officials, healthcare providers, hospitals, and other healthcare facilities have a clearer picture of what the public health landscape looks like about a particular disease. And with this being a new virus, we need this early on so that we can understand how this will impact all elements of our society. Having that public health landscape includes information on how different communities are being impacted by a disease like COVID-19. That then gives us the tools we need to respond to each community. I've talked in the past about how our Latino and African American communities are being disproportionately impacted by COVID-19 in Rhode Island. We're also seeing that nationally. When we're making policies to support communities where we see disparities, we can't just act on anecdotes or individual observations. We need data, and very specific data, so that we can respond to it and address what we're seeing in this situation. It's the fact that communities need the support, the investment, the resources, so that they have access to the normal living conditions at a quality level, schools, jobs, all of that would allow them to prevent against further spread of diseases like COVID-19. We get that specific type of data that helps inform how to move forward through things like testing. And having the testing site that was set up in Central Falls that the governor mentioned is a perfect example. That and all of the other communities that we have testing established in. We talk a lot about our work being done to ensure that all people in every zip code have an equal opportunity to be healthy. When it comes to COVID-19, we need testing as one of the tools in the toolbox to help act on that commitment, and then be able to respond to it and make sure each community has the investments and the resources they need to remain healthy. So again, I want to thank everyone who has helped advance our testing work in Rhode Island, which is absolutely critical, and then also remind everyone and thank again the fact that we have a Rhode Island COVID-19 testing and validation task force. They are going to help provide expert input on how we can learn from the testing that the governor shared. We're starting with Stop and Shop. We want to make sure it's understood. We already have information about the diagnostic tests where you will be swabbed and it may take 24 to 48 hours to get results. We are more familiar with that. There's still a lot to learn about the serology test that exists. Do antibodies really form? What does it mean? What can you do with it? Is it then safe to use it as information to make a decision? Doing this allows us to collect that type of information and better understand how we can move forward. And that task force is going to really guide us in knowing what is the best test and how does it work and how do we interpret that information. So we are learning as we go, but you can be assured that Rhode Island is at the front of the line in helping to gain that information and make the best decisions possible. So I'll also close with a thank you, knowing that this is the start of National Nurses Week, particularly because nurses have a special place in my heart. My mom retired as the director of nursing at a hospital in New York where I grew up. And I was very proud of all she was able to achieve, in spite of being told that she couldn't at the beginning of her career. So I know firsthand, particularly as a physician, but then also as the daughter of an amazing woman, how critical and valuable nurses are to everything that goes on within the healthcare system and within the health system as a whole. So, as the governor mentioned, if you know any nurses in your life, tell them thank you. Encourage the nursing students who are out there. This is such an amazing and wonderful career to go in, and we are grateful to all the nurses who are out there on the front lines working diligently for us.